Well, I'd like to make a presentation that's a little different today. Everyone will probably know that the person who was responsible really for the establishment of Dalhousie Medical Faculty was Sir Charles Tupper, who of course wasn't a graduate of Dalhousie. He had graduated before Dalhousie was formed. Dalhousie Medical School was formed, but he was quite unique because he was not only a medical doctor, but he was also very active in politics, both federally in Canada and also in Nova Scotia. In fact, he became the Premier of Nova Scotia at the time that the medical school was established in 1868. And then he became a cabinet minister in the Macdonald federal government in Ottawa, and later on became Prime Minister, the only medical doctor in Canada who became Prime Minister of Canada. So anyway, I thought it'd be interesting to see if other medical graduates of Dalhousie had entered the political arena and had made important contributions to healthcare in Nova Scotia through their work as politicians. So I discovered that down through the years since Confederation, there have been a total of 49 Dalhousie Medical Graduates who've gone into politics. 23 Conservatives and 26 Liberals. It's quite remarkable that we're almost equal as far as the parties are concerned. So I made a list of who the medical graduates were and the year they graduated, the party they belonged to, and when they were elected. And in the list, you can see quite a few names. The two I'd like you to concentrate on in the talk are George Murphy and Frank Davis, because they're the two who made significant contributions to our health care in Nova Scotia. And one was a Conservative, the other was Liberal, as you can see. We'll talk about them quite a bit later. So there are many, 49 altogether, and here are more of them, including William Duff Forrest, who was the son of the president of Dalhousie, John Forrest, graduated in 1898 and entered politics in 1937. And on this page, we do have three more individuals who made significant contributions as health officers in Nova Scotia: Maynard McCaskill, Jim Smith, and Ron Stewart. Ron Stewart is particularly significant because he's the one, while he was health officer for Nova Scotia, who introduced the air ambulances that you see helicopters flying around Nova Scotia and landing on hospitals frequently. He's the one that brought that to Nova Scotia. He had previously been in California and involved in ambulances, air ambulances, and when he arrived in Nova Scotia back home, he decided we should have one too, and we have more than one now, of course, and they become very helpful to moving injured patients from different parts of Nova Scotia to the QE2. Also, Dalhousie Medical Graduates not only served in Nova Scotia, but they also served in British Columbia, New Brunswick, and Prince Edward Island, and you can see a list of them here. And some of them did become health officers in those provinces. The ones that are highlighted are the health ministers for those governments. So here's a list of all the ministers of health, education, and welfare among the medical graduates, and the top two are George Murphy and Frank Davis. But you'll see I list quite a few of them for PEI as well as New Brunswick. And also there were medical graduates from Dalhousie that elected to the House of Commons, and you see here John Bethune, who was from Bedeck. He was the first, 1896. And he had previously been a member of Parliament. Now, if you look closely at those lists, you discover that no Dalhousie medical graduate has been elected to the House of Commons since 1940. Now, that may be a little surprising, although when you think of a medical doctor with a practice, it's not easy for them to leave the practice and go into politics, because once they do, of course, all their patients have to find another doctor. So a doctor would really hesitate quite a bit before they'd make the decision to run for election, because they would be very upset that they're relieving so many patients. Most doctors at that time in the 1940s would have 2,000 to 3,000 patients that were dependent upon them. So to leave and go to Ottawa for 4 years really would interrupt a lot of people's lives. The other observation, there were no female medical graduates from Dalhousie who went into political life, either federally or provincially, so far. There were no medical graduates elected to the Nova Scotia House of Assembly since 1997. Only one medical graduate of Dalhousie served as Premier of Nova Scotia, and that was John Ham, who was a Conservative Prime Minister during the 1980s. 17 of the 46 medical graduates elected as MLAs became cabinet ministers, which is quite a significant number. So let's take a look at the evolution of the public health system in Nova Scotia, because of course these individuals were very much involved. So if you look at it, and we'll go right back to the beginning, in 1754 the governor of Nova Scotia issued a proclamation that enforced quarantine procedures in Halifax Harbour. At that time, they were very, very concerned about smallpox, and there were many ships coming into Halifax with smallpox from various places like Ireland and Scotland, and so they definitely needed to have quarantine. Now, quarantine comes from the word for 40, the French word for 40, and implying that they would quarantine people for 40 days, and usually they would quarantine them on McNabb's Island or on the ship that they were on. And the health officer, in 1790, there were 11 health officers appointed for Nova Scotia. Those health officers would go out to those ships and check out to see if there was any smallpox or yellow fever on board. It's a very dangerous job, that's for sure, because smallpox was very contagious. In 1820, Council proclaimed quarantine in Halifax on 9 occasions between 1800 and 1820. In other words, there were many ships coming in with diseases, and they had to proclaim quarantine to keep them out of Halifax. In 1831, cholera was the problem, and Lieutenant Governor Maitland appointed a superintendent of quarantine, a central board of health, 12 health wardens for the town of Halifax, and 16 new health officers for various seaports in Nova Scotia. So they're very concerned about contagious diseases. 1835, Halifax appoints a health inspector who was responsible for maintaining cleanliness. Might sound odd they would maintain cleanliness, but what they really were referring to was trying to deal with the fact that in Halifax at the time there was no treatment of sewerage at all, and most houses had an open cesspool in their backyard, and when it rained the cesspools would overflow and the feces would run down the streets in Halifax. You can imagine that cleanliness was a very difficult issue. The health inspector went around to try to arrange that people would maintain their cesspools in a proper way, although that was almost impossible. 1856, Halifax appointed its first city medical officer and established a board of health. The Confederation year of 1867, the federal and Nova Scotia governments collaborated to establish a permanent quarantine station on Lawler's Island. Lawler's Island is between McNabb's Island and the Eastern Passage. So it's a very small island, but it was an island, and therefore it was good for a quarantine station. It opened in 1873, was under the control of the port quarantine officer for Halifax. 1870, the city of Halifax established an infectious disease hospital at the Rockhead Prison, near the site for the isolation of smallpox cases. Rockhead Prison was in the north end on Aroby Street and very close to Africaville. In fact, it was right above Africaville. 1873, the first general smallpox vaccination was held in the city of Halifax. Before that, people were just randomly vaccinated because the government just didn't think it had enough money to vaccinate everybody, so it vaccinated only those people that sort of wanted to be vaccinated and were willing to pay. In 1887, the provincial government appointed Dr. Alexander C. Page as Inspector of Humane Institutions to annually inspect and report on the VG Hospital, the Mount Hope Asylum, and the poorhouses and asylums throughout the province. In 1893, a provincial board of health was established and began to publish annual reports on the state of contagious diseases, including diphtheria, typhoid fever, and tuberculosis. The secretary was Dr. Alexander P. Reid. 1894, we have a provincial diagnostic laboratory established at the VG Hospital under the direction of the first provincial bacteriologist, Dr. William H. Hattie. And in 1904, a Department of Public Health was established by the Nova Scotia government with provincial health officer, Dr. Alexander P. Reid, in charge. So you can see that things are gradually evolving to make public health a more significant department to control contagious diseases. So the first two public health officers for Nova Scotia were Dr. Alexander P. Reid, seen on the left, and Dr. William H. Hattie, seen on the right. And they served from 1904 to 1922, so almost 20 years. In 1904, the Nova Scotia Sanatorium opened at Kentville for the reception of early cases of pulmonary tuberculosis. And in 1904, the Faculty of Medicine at Dalhousie added lectures on public health to its curriculum. 1912, the Sisters of Charity opened Lourdes Tuberculosis Sanatorium in Stellarton with 15 beds. 1918, the city opened an infectious disease hospital on Moore Street during the Spanish influenza pandemic of 1918-1920. In 1919, the Office of Provincial Inspector of Health was created with Dr. Arthur C. Jost filling that position until 1929. And in 1921, the Halifax City Tuberculosis Hospital was opened on Moore Street with 60 beds. 1922, the Dalhousie Public Health Clinic was opened on Moore Street with money donated by the Rockefeller Foundation. The Halifax Visiting Dispensary occupied a portion of that clinic. 1926, the Provincial Public Health Laboratory was reorganized with Dr. John Mackenzie, a full-time director. Dr. Mackenzie had taken postgrad studies in bacteriology at Johns Hopkins and at McGill. So we come to 1930, and that's when Dr. George Henry Murphy becomes Minister of Health. Graduate of Dalhousie, and he becomes Minister of Health in 1930, and he's Minister of Health for 3 years. Well, he achieved a lot during that 3 years. He launched an anti-tuberculosis program. Tuberculosis was the main cause of death of adults for many, many years prior to 1930. There were 2,000 to 3,000 Nova Scotians dying every year from TB, tuberculosis. And there was no cure, there was no treatment. Well, the only treatment really was at the sanatorium, where the treatment involved fresh air, good food, and rest. It was not really what you would call a certain treatment. It was just sort of a way of dealing with the problems of difficulty of breathing due to tuberculosis. So it wasn't until really 1943 or 4 that we have a medication that effectively dealt with tuberculosis. Dr. Murphy also provided assistance to Dr. Norman Goss to establish the cancer clinic at the VG in 1932. He established the Provincial Public Health Nursing Program in the same year, 1932. He established the Office of Provincial Pathologist and appointed Dr. Ralph Smith to that position in 32. And he established a free tissue examination program for physicians and surgeons in Nova Scotia. So that short 3 years, he did a magnificent job. However, his party was defeated in the 1933 election. So the new Minister of Health was Frank Roy Davis. Dr. Davis, who was a Dal graduate, he lived from 1888 to 1948. Now, Frank Davis was Minister of Health for 15 years, and he did a great deal. He reorganized the Ministry of Health in the provincial government. So his Ministry of Health contained not only him, but a deputy minister, a chief health officer, a director of social welfare, divisional health officers, a director of the bacteriological laboratory, a director of the pathological laboratory, an epidemiologist and statistician, a sanitary engineer, a psychiatrist, a superintendent of nursing services, and 19 public health nurses. These public health nurses traveled around Nova Scotia trying to convince people to try to improve their sanitary condition within their homes and within their schools, and educating the children in how to properly conduct themselves with respect to public health. Continuing on with Dr. Davis, he established the position of traveling tuberculosis diagnostician in association with the Kentville Sanatorium, provided financial support for physicians and surgeons to take postgraduate training in public health and epidemiology. That was very popular, and a number of Dalhousie graduates took that program. Introduced a dental hygiene program in Nova Scotia schools, established an infantile paralysis or poliomyelitis clinic, established a division of physical education and nutrition, established a division of industrial hygiene, a division of neuropsychiatry, and he planned and implemented the construction of the VG Hospital, which opened in 1948. A remarkable lot of activities during that 15 years. Not over yet. He improved the Children's Aid Society programs, assisted in the establishment of the Maritime School of Social Work, which opened in 1941 in Halifax, promoted the enactment of the old age pension legislation in 1933, and also assisted in establishing the Family Allowance Program in 1945. You could see he did a lot while he was minister. And finally assisted in the establishment of Nova Scotia School for Boys in Shelburne, which opened in 1947. So that brings my talk about Dalhousie graduates to an end. So I hope you've enjoyed this and it's added some information that you didn't already know. Thank you.